and welcome to Basic Life Support in children ages 1 to 8. There are some slight differences between BLS for adults and children. One is that 2 rescuer BLS for children requires a compression to breath ratio of 15 to 2 rather than 30 to 2. Another is that you can use one-handed chest compressions on small children, and compressions are at least a third of the chest deep. One of the bigger changes is that 1 rescuer BLS for children calls for performance of CPR for 2 minutes before calling 911. Next, we have the pediatric BLS algorithm. We highly encourage you to study the algorithm in your manual. Next, we'll go further into 1 rescuer BLS in children. The first step is to determine if the victim is responsive by shaking them or shouting at them. Step 2 is to assess if they are breathing. This can be done by either putting your ear up to the victim's mouth or watching the chest. Step 3 is to yell for help if he or she is not responding or breathing. If someone responds, you would send him or her to get an AED, and it would essentially change to 2 rescuer basic life support. Step 4 is checking the child's pulse, but for no more than 10 seconds. You could do this with either the carotid pulse on the side of the neck or the femoral pulse on the inner thigh and the crease between their leg and groin. Step 5. If there's no pulse, or you can't tell, begin CPR with a 30 to 2 compression to breath ratio. If the pulse is less than 60 beats per minute, still initiate CPR. Compression depth should be about a third of the chest. So, for most children, this is about 2 inches. Step 6. If after 2 minutes or 5 cycles of CPR, no help has arrived, leave the child to call EMS and get an AED. Step 7 is to use the AED. We'll go more into depth about AED use in another section. For now, just know to follow the AED steps and continue CPR until EMS arrives, or until the child comes around. Next, we'll do 2 rescuer BLS for children. You'll find that the process is very similar. Step 1 is to shake and shout at the victim to determine responsiveness, just like Step 1 was for 1 rescuer. Step 2. Assess if they are breathing. If the child isn't responding or breathing, send the second person to activate the emergency response system and get an AED. Step 4. Check either the carotid or femoral pulse, but make sure not to waste time doing it longer than 10 seconds. Step 5 is to begin CPR. If there was insufficient or no pulse, if the second rescuer has not returned, do 30 to 2 ratio CPR. When the second rescuer returns, begin 15 to 2 CPR, with one doing the 15 compressions, followed by the other doing the 2 breaths. Step 7 is to use the AED and follow the prompts. Continue this and CPR until EMS arrives, or the child's condition normalizes. In child ventilation, you'll want to ensure that the bag mask is the correct size. It should cover the whole mouth and nose, but not the eyes and chin. Open the airway with the chin lift head tilt technique and squeeze the bag to deliver breaths. Feel free to take this time to review this chart for a better idea of proper ventilation. This is all for BLS in children. Next we will cover BLS in infants.